Nutrition Intervention, Terms and Use. This module is based on the Electronic Nutrition Care Process Terminology 2015 edition and is prepared by the Nutrition Care Process team, a joint project of the Nutrition Care Process and Terminology Committee, the NCPT Workgroup, and the NCPT staff. By the end of this module, the participant will be able to understand the organization of domains and classes of the nutrition intervention terms, and understand the relevance and implement usage of the terms within each domain and class. The nutrition intervention terms are organized into 4 domains, and within each of these 4 domains, terms are then organized into classes and subclasses. Each term has been given an alphanumeric designation to help link the placement of the term in the term list and the corresponding reference sheet. There is no need or reason to include this alphanumeric code in documentation. The domain food and/or nutrient delivery is defined as the individualized approach for food and nutrition provision. The classes within the food and/or nutrient delivery are listed here on this slide. Meals and snacks. Enteral and parenteral nutrition. Nutrition supplement therapy. Feeding assistance. Manage feeding environment. Nutrition-related medication management. The nutrition education domain is defined as the formal process to instruct or train patients in a skill, or to impart knowledge to help patients voluntarily manage or modify food, nutrition, and physical activity choices and behavior to maintain or improve health. The 2 classes within the nutrition education domain are listed here on this slide. Nutrition education, content. Nutrition education, application. The nutrition counseling domain is defined as a supportive process, characterized by a collaborative counselor-patient relationship to establish food, nutrition, and physical activity priorities, goals, and individualized action plans that acknowledge and foster responsibility for self-care to treat an existing condition and promote health. The 2 classes within the nutrition counseling domain are listed here on this slide. Theoretical basis and approach. Strategies. Coordination of nutrition care by a nutrition professional domain is defined as consultation with, referral to, or coordination of nutrition care with other providers, institutions, or agencies that can assist in treating or managing nutrition-related problems. The 2 classes within coordination of nutrition care by a nutrition professional domain are listed here on this slide. Collaboration and referral of nutrition care. Discharge and transfer of nutrition care to new setting or provider. Reviewing the nutrition intervention terminology sheet to see the organization of terms can be accomplished by visiting the URL indicated on this slide. Also on this slide is an example of one nutrition intervention term. The domain, food and/or nutrient delivery, is indicated by the letters ND. Enteral and parenteral nutrition is the class heading, defined for enteral as nutrition provided through the GI tract via tube, catheter, or stoma, and defined for parenteral role as nutrition provided intravenously, centrally, or peripherally. Enteral nutrition is the subclass, defined as nutrition provided through the GI tract. Modified composition of enteral nutrition is the term, and you can see on the slide the alphanumeric code and the 5-digit SNOMED unique identifier for the term. As explained in previous tutorials, the SNOMED unique identifier is assigned for data tracking purposes in electronic health records. The uses of nutrition interventions may vary by practice setting, but they are not limited by the practice setting. Some examples are provided on the next slide. It may be helpful to look at the nutrition intervention terminology sheets while listening to the descriptions on the next slide. Nutrition interventions within the food and/or nutrient delivery domain are commonly used by RDNs in institutional settings. Nutrition education content interventions may be utilized more often in institutional settings, as these are terms that describe the explanation of nutrition interventions that the patient is to carry out after discharge from the institution. Nutrition education application interventions may be utilized more often in the outpatient setting. Nutrition counseling interventions will likely be utilized in outpatient settings. Finally, nutrition interventions within the domain coordination of nutrition care by a nutrition professional can be used in most practice settings. To summarize, in this module, we have reviewed the organization and use of the nutrition intervention terms. This information is helpful for understanding the types of terminology available and in which practice setting these terms are most likely utilized. Please proceed to the next module for a discussion of the development of the nutrition prescription.